name's Jill Perry, and I'm here to talk about nursing burnout. My clinical rotation happened at the University of Kentucky Hospital at the Interventional Radiology Department, in the pre-op and post-op and procedural areas. I came up for the idea of nursing burnout for my project because since I've been a nurse at UK for 3 years, the Interventional Radiology Department has been ran primarily on traveling nurses. Within the Interventional Radiology Department, they also do quite a few procedures for microwave ablations, TheraSpheres, cerebral angiograms, etc. My main goals for this project were to help educate nurses better understand the signs and symptoms of nursing burnout and compassion fatigue, what resources are available from the hospital, and to help combat burnout and compassion fatigue, and how to access those resources. Room Benita state that up to words of about 70% of nurses and 50% of physicians can actually experience burnout at any given time. So I was pretty shocked to find out such a high number. Burnout results from long-term stress related to inappropriate managed work environments. In addition, public health emergencies such as the COVID-19 pandemic create additional workplace difficulties and ethical problems that can intensify burnout among nurses. My learning objectives were quite simple. I wanted individuals to be able to at least identify 3 signs and symptoms that indicate a nurse is experiencing burnout or compassion fatigue, explain how to locate and access hospital-provided resources and therapies to help them cope with burnout by the end of the class, and we'll discuss and identify at least 3 coping mechanisms or therapies to help prevent burnout and how to incorporate those therapies into daily life by the end of class. My plan of action was simple. I created a pre-survey that related to the signs and symptoms of burnout, as well as what therapies that nurses actually believe were offered by their hospitals, and what coping mechanisms or therapies that they think would ultimately help them prevent burnout. I created this educational PowerPoint to help identify the signs and symptoms of burnout, as well as discuss and educate in the same PowerPoint which therapies and resources are offered by their hospital, further educating nurses on various coping mechanisms that they can use outside the hospital to combat their own burnout. I also wanted to create a survey to identify additional signs and symptoms of burnout that we learned about, as well as additional coping mechanisms nurses learned about and how to access those hospital resources. Next, we'll look at the pre-survey that I came up with that'll help us gauge the understanding of a nurse's understanding of burnout and what burnout resources are available. So this is my signs and symptoms of nursing burnout survey. My pre-survey consisted of just these 5 simple questions to help gauge or direct the rest of my project. Next up, we have the signs and symptoms of nursing burnout that I got from the pre-survey. Quite a few of them. I was surprised to find out so many that I hadn't even thought of myself. Al-Habri et al. Researchers theorize lower level burnout among frontline workers may be the result of health professionals having to place all of their focus on achieving positive outcomes for patients. However, this arguably implies that nurses focus not on their own emotional well-being, which is the leading risk factor for the development of compassion fatigue, as their tendency is to put the care needs of their patients above their own care needs. Brew and Benita also state that cynicism, which is identified here, is one of the most dangerous manifestations. It can create a vehicle for commiseration, leading to negative assumption, gossip, and toxic energy. So it can kind of create a cascade of events. Further continued is some additional signs and symptoms: gastrointestinal issues, agoraphobic. People no longer jump at opportunities when they're agoraphobic. They fear places or situations that can cause panic, helplessness, or embarrassment. Room Benita also state that the characteristics of professional burnout can pave the way for negative self-talk, and it has been determined that healthcare professionals may be at higher risk for death by suicide than the general public, just because they're increased risk of burnout. As far as UK goes, they offer quite a few resources and utilization. There are actually 8 main categories for resources that UK offers. However, I believe that the work, eat, move, and be categories are the best for combating nursing burnout. Other 4 benefit categories consist of recover, learn, care, and save, such as financial resources, etc. After completing the survey, it was evident that all of these resources and services are very underutilized. My question number 3 in my survey: where do you find or access what these resources are? Quite a few people had no idea. I myself had to just Google University of Kentucky Human Resources, clicked on the Benefits tab, and Employee Benefits to find these. UK CareWeb is another place you can go. Within the internet, you click on nurses on the left-hand side, click in the search bar, and search for human resources, click on benefits, and click for employees. That seemed like quite a lot of steps when considering that nursing burnout is such a big problem. It needs to be more at the forefront, especially with mental health and easier to access. The most important resources, I believe, was the B category. It's probably the most useful in combating burnout. It makes you more self-aware, which come later we will explain that self-awareness is the key to combating nursing burnout. They have 5 free counseling therapy sessions with licensed therapists, well-being consults. They practice skills such as relaxation, body scan, guided imagery, journaling, yoga, stretching, etc. Next up, we have how to prevent burnout. You need to really become self-aware, practice resilience, evaluate your mental well-being, set a routine, set small goals and add to them, incorporate new strategies, and maybe switch it up. Sometimes routines can become monotonous. Effective self-care practices involve self-awareness, self-compassion, and the implementation of a variety of strategies across physical, social, inner self-care domains. Resilience is a daily practice that is about making decisions regarding how to behave, act, and respond to things. You have to understand what you need for your own personal well-being. If you do not take personal responsibility and have some boundaries for your own resilience, then you cannot expect an organization to take care of you and to manage your burnout. So I think that hits home quite a bit. You have to take care of yourself first. You can't expect other people just to do it for you because they're not going to be able to help you if they don't know if anything's wrong. So the first key is to identify and recognize that burnout is real and it's happening before you can even take the steps to take care of yourself. As far as Rubenita further state, mindfulness, focused breathing, practicing gratitude, journaling, art, and coloring are also prevention and reduction activities. Mindfulness, such as stretching and yoga, focused breathing immediately calms the mind, allowing individuals to regain and control focus. Practicing gratitude can help build healthy relationships with colleagues, increase positive emotions, improve overall health, and boost coping capability when the difficult situations arrive, which I think helps combat that cynicism atmosphere with that negative self-talk. Okay, so next up, the survey results that I actually kind of compiled here, a list of them. Can you list 3 signs of symptom of nursing burnout and compassion fatigue? Complaining about everything, decreased quality of work, insomnia, indifference, not taking the time to listen to their patients, judgmental. Do you know, or can you list what services are provided by UK Aubrey Chandler Hospital in helping to combat nursing burnout and compassion fatigue? Mental health services, opportunities to change type of nursing positions, and massage. Where do you find access to what these resources are? Again, UK CareWeb, internet, click on nurses on the left-hand side, click in the search bar, search for human resources, click benefits, click on for employees, or Google search University of Kentucky Human Resources, benefits, and employee benefits. What best practices are in your current workplace to help nurses combat burnout? Question 4. Rotating assignments, vacation, PTO, allowing staff to voice concerns of leadership, self-scheduling, knowing your assignment the night before, not allowing staff to pick up overtime shifts if they are showing signs of fatigue, frequent nursing web-based trainings, emails about current acceptable approved practices, nurse-patient ratios are better than most places and per the ANA guidelines. My most important question, I think, was question 5. To sum up the last question of the survey, what changes would you like to see in your workplace regarding combating mental health and burnout in nursing? Wellness days should be offered to all staff, full-time, part-time, and PRN, and allow them to not have to be scheduled days off. Most people, when they're feeling burnout or maybe feeling like they're going to break down, don't necessarily have the time to schedule those days off. 2 or more wellness days to make it 2 additional wellness days to make it 2 wellness days every 6 months. Remind staff that they have these wellness days to be used. So more reminders, more getting out there that we do have mental health resources that help combat burnout would be great. Very little funds are devoted to the concept that healthy bodies, healthy minds, and well-being of nurses are more likely to not only produce the optimal healing environment for our patients, but improve the healthcare organization's bottom line. So if we take care of not just our physical and social health, but also our mental well-being through the combating nursing burnout, will improve the hospital's overall bottom line. More initiatives, I do agree, with self-care and awareness and fostering resilience to decrease medical errors and will ultimately also increase the quality of our patients' care. As far as literature versus reality, very few people were able to identify any best practices in their workplace regarding mental health. Very few focused on self-care from the employee survey, which was completely different than what literature suggested was the focus on self-care and admitting that burnout is real. Self-awareness and resiliency are key in combating burnout, as noted by several articles. So again, people weren't aware of all the services offered, nor how to get them. I literally just had to Google the provided services offered by UK, as they were so interlaid and hard to find behind several tabs. I do agree this needs to be changed and easier to be found, all the resources that are available to our employees. When dealing with special times such as the pandemic, which it can increase stress for multitudes of reasons and also increase the likelihood of burnout. Due to how the pre-survey was structured, I believe I did guide people away from answers that would look more like they were focusing on themselves and self-care, which my research article stressed was important. If the most important way to combat burnout, and focus more on the workplace by asking what best practices are in place at your workplace to combat burnout, and what changes you would like to see in your workplace regarding combating burnout. I also noted that due to the pandemic, many staff meetings have been canceled due to restrictions of people gathering in small areas. This was of great concern to many nurses who noted that they really needed their voices to be heard in such stressful times and to have an understanding management team. I know further examples of people displaying burnout, unhealthy eating, substance abuse, drinking more, not sleeping, things of that nature, complaining of being tired all the time. So current best practices. The current best practices led me to focus on how to identify and why it's important for my project regarding compassion fatigue and burnout. The following are examples that stress why all the above of resiliency, self-care, reducing the stigma, educating, making resources readily available will help combat burnout from all these research articles. Al-Harbi et al. Said frequent debriefs of colleague support only through the collaborative efforts can risks associated with compassion fatigue and burnout in the critical care nurse workforce be identified and mitigated. Example again why I think nurses really need to vocalize their voices and opinions to be heard, because the pandemic has canceled many staff meetings. Mills et al. Also said prioritizing the physical, mental, and social well-being of the workforce can be an important antecedent to sustain clinical care. This is reflected in the recent policy initiatives around the world to introduce a position of Chief Well-Being Officer to the executive suite of health services administrators. Well-being and resilience depend on self-care and staff support, which together need to be more than adequate in times of usual operations to ensure responsiveness and capacity during times of crisis such as a pandemic. A well-being or mindfulness department was identified as a need by an employee in the pre-survey. Croak 2020 also states that the organization leaders must focus on helping nurses build resiliency, and individual nurses must implement strategies to improve their own health and happiness. A resilient workforce can again aid in decreasing stress, anxiety levels, and allowing individuals to adapt to a more readily constant changes in the environment and increasing the overall quality of life. So taking the best care of ourselves will only allow us to take the best care of our patients. We can't really pour from an empty cup. My learning outcomes. They were achieved through the pre-survey, the presentation of this PowerPoint, and post-presentation debrief and discussion. My learning outcomes were achieved through a PowerPoint. It's my educational tool through the initial and pre-survey, and we're able to identify more signs than I could think of for burnout. After compiling survey results and teaching them even more about signs and symptoms of burnout, many of the nurses were surprised that they too hadn't thought of a particular sign or symptom of burnout, and were able to at least identify two additional more signs and symptoms. I decided to go with a post-discussion instead of a survey, because my pre-survey, I realized I guided people away from self-awareness and focused them on their job site and issues at work, which I realized a lot of the research pointed towards self-care, and not just the work improvement strategies that be implemented at work that the nurses identified were the biggest issue. The nurses did say they felt more competent in accessing UK's resources regarding burnout. We also talked a lot about how additional signs and symptoms of burnout or added stress can come across as normal, but not really normal. For instance, if someone's blood pressure usually runs in the 90s, but added stress, longer hours, etc. from the pandemic, their blood pressure goes up to 130s and 40s. Although this is a normal range, it's not really normal for them or healthy. Nurses were also able to realize the importance of self-care, and some did admit stress eating, drinking more, getting more sleep because of all the added stress. But after this PowerPoint, they realized that in order to provide the best possible care to their patients, they agreed that they needed to self-reflect and make positive changes. But many of those nurses were kind of reluctant to share what strategies they would call in to try to change. Reflection. Failure of ignorance is one thing. Failure, despite knowledge, is negligence. With all of the knowledge regarding burnout and its prevention, it is imperative that the healthcare industry acts now in terms of limiting burnout, especially during the pandemic, and quits being negligent. We need to change the stigma associated with mental health. After All healthcare workers reach us far more than just ourselves. Our community, our family members also look to us for guidance. It is time to lead by example and confront the stigmas of mental health and head on, and to improve the quality and safety of future patient care in and out of the hospital. And here I have my resources, so thank you guys for your time.